Hello, everyone. My name is Ashley Harrison, and I chose the topic of creating a manuscript of how family consumer science education relates to many different occupations. The two I chose to focus on was agriculture and healthcare. Growing up in rural Nebraska, my entire life has been based on agriculture. Almost every single student I have either has a parent that is directly into agriculture or works at one of the five different seed companies here in our small town. So agriculture is big, not only in Nebraska, but the United States. Farmers and ranchers grow the crops anywhere from corn, beans, wheat, or they grow the food products such as cattle, or raise the food product, excuse me, such as cattle, pork, poultry. And family consumer science allows these to be made into consumable products. Historically, family consumer science was started on home economics that was both food and nutrition as well as textiles. Crops such as flaxseed for linen and cotton, as well as wool from sheep, are made into products that you and I wear every single day. Here in America, agriculture is one of our main producing, um, money making economic jobs, is what I'm trying to say. And so family consumer science education relates to this from the very beginning. Since 2012, there has been many research done with farm to table movements. Farm to table movements means that you see the crops from the very beginning. They start growing locally, they're watered and produced and then harvested and then later set to individuals to be consumed. This encourages individuals to consume locally grown crops, anywhere from farmers markets to school gardens to community gardens. An article I read was by Abby Macy in 2015, and she states that this keeps food dollars in local communities and offers new business opportunities that can bring young people back home. Individuals from school age all the way up to adult are able to produce and provide these food-based products for individuals from the farm to table. Individuals are also able to see the proper nutrition that locally grown crops versus store-bought crops allow for us to have. The second main topic I discussed in my manuscript was healthcare. Mental health we are in a mental health crisis since the 2020 pandemic. Many family consumer science educators teach courses all the way from human development all the way to families in crisis. Families in crisis curriculum explores many different mental health related diseases such as eating disorders, depression, and anxiety. Since 2020, there has been many programs that have been installed using family consumer science teachers as well as mental health professionals. These programs are designed in communities to help prevent and support individuals that are suffering from a mental health illness. Family consumer science is based on the family. It is the forefront. Mental health needs to be addressed from grade school all the way up to senior citizen. The second part is dietitians. I already mentioned earlier that family consumer science relates to the growing of proper crops such as corn, beans, cotton for clothing, and dietitians help individuals learn that the proper nutrition in their body helps maintain the best optimal of life. It is estimated that anywhere between 20 and 50% of hospitalizations are related to malnutrition and dehydration here in the United States every year. Proper nutrition is at the forefront of healthcare. Dietitians work very closely with hospital staff to develop proper meals for individuals from pediatrics all the way up to senior citizens. They work with both inpatient and outpatient individuals that are suffering from malnutrition of some sort. Dietitians also work with mental health professionals with individuals that have eating disorders or depression related illnesses. Dietitians are also relate to family consumer science education, and family consumer science education relates to dietitians because of our foods and nutrition and culinary arts curriculum. Family consumer science education can can collaborate with dietitians to help foster projects to help have students learn the different needs that they have for each other, is what I'm trying to say, I believe. The last part is hospital staff. It is estimated that over 130,000 individuals are hospitalized due to poor handling of food. Family consumer science education installs the proper safety and sanitation of food products. Cross-contamination is one of the most common ways that foodborne illnesses are started, both in the restaurant industry as well as in the homes. The body of knowledge states that we need to integrate the human economics framework better. We've always stuck to the disease approach and when it comes to illnesses, and we need to get back to the family dynamics. Family consumer science can relate to almost every single occupation, from business to lawyers to restaurant staff, all the way up to agriculture and healthcare that I laid out a few points today. Thank you.